Hi, my name is Richard, and I'm here to go over my meter dose inhaler competency. That's a uh, MDI. And in this particular case, before entering the patient's room, I will go ahead and check their chart. I'll be checking for their vital trends, their name and date of birth, physician's orders, anything that might impact the treatment, I will take note of. In this case, I will go ahead and gather my equipment. It'll be gloves, blood pressure cuff. We have a peak flow meter and a pulse ox as well as my stethoscope. Once I get them sanitized, I'll be ready to enter and I'll go ahead and knock.
Come in.
Hi, my name is Richard, and I'm a student at Hartnell College. I'm here to do a MDI, a meter dose inhaler instruct for you, with you.
Okay.
And may I have your name and date of birth?
Christian Galvin, uh, May 25th, 1991.
All right, may I take a look at your wristbands? Oh, thank you. May I call you Christian?
Yeah.
All right, thank you, Christian. So we'll be, as I mentioned before, we'll be doing um, an instruction on MDI. And before we do, we'll be taking your vital trends,
Okay.
your vitals today, and we'll be doing it twice. So
Okay.
one before and then one after. Thanks for waiting for me on that. Sometimes these gloves are a little tricky. All right, Christian. So we'd like to start with taking your blood pressure. May I use this arm?
Sure.
So let me know if it's uncomfortable, okay?
Okay.
Would you mind holding on to this for me? Yeah, sure. Yeah, appreciate it. All right, Christian, thank you. I got about 120 over 85. Is that about normal for you?
Mm-hmm.
Thank you. All right, and we'll be taking your oxygen saturation level here. It's called a pulse ox. So go ahead and put this on your finger. Sorry, not too used to this particular one. Go ahead and put it in there. Okay. So I got a saturation level of about 97%. That's pretty good. And could you, and I'll take your pulse, so you please put your arms across your chest right over here. That's okay, good. Thank you, appreciate it. Christian, thank you. So I've got 35 beats per minute. Let's multiply by 2, we got 70. Normal range. And respiratory rate, I got 8 in 30 seconds. Multiplied by 2, we got 16. So I'm going to be listening to your lungs. So I'm going to start from the back, if that's all right. And I'll also be listening to your front.
Okay.
So I'm going to go right behind there. So wherever you feel it, just go ahead and take a deep breath in, okay? All right, thank you, Christian. And with your permission, I'm going to open your gown a little bit, just so I can listen to the front.
Go ahead.
Thank you. Yeah, and so you feel it, just go ahead and take a deep breath.
Sorry.
That's okay. Go ahead, take a deep breath. And I'm going to be listening to your throat right here. All right, thank you, Christian. Okay, and we'll also be doing a peak flow meter, and we'll be doing this twice, once now and then after we do treatment. So what I'd like you to do is blow out as hard as you can. I've set the goal for you according to your height and age. So I'd like you to blow as hard as you can. It's like blowing a birthday candle, and I want you to be to move this indicator as close to that goal as you can. Okay. So we're doing it 3 times. So go ahead and do it for me right now. Take a deep breath and blow out. Great job. And if you do that once more here. Good job. All right, one more time. Make it the best, all right? Deep breath and then blow as fast as you can. Wow, great job. Okay, so let's go ahead and start with the medication here. So we've got your inhaler, your meter dose inhaler. And we got an accessory device called a spacer. Next to you here. So the medication here is albuterol. It's within this canister, and the albuterol will help open up your lungs. You have a bit of restrictions right now, so it'll help you breathe a lot better. There is side effects. It might make your heart rate a little bit higher than normal, and it might make you a little jittery. But if not everybody gets them, and if you do get them, it's perfectly normal. So for a brand new device, or it's been stored for a while, we want you to go ahead and warm this thing up. It'll allow the medication to flow better. Just between your hands, and just go ahead and rub it a few times between your palms. Once you've done that, go ahead and insert it into the inhaler itself, and there's a little port right over there, and go ahead and insert it on the inside. Remove the mouthpiece. And sometimes there are buildup inside, and you're going to want to prime this. Just remove the dust and dirt that might build up. So you're going to want to shake it. It's also good to mixing the medication. And you're going to want to actuate it up in the air a couple of times just to blow away any kind of dust that might be building up there for you. Ideally, you're going to want to use this with your spacer. And the spacer basically holds your medication in this little chamber right over here. So you basically just go ahead and insert that inside here. And when you're ready, you go ahead and hit the actuated device once. And it'll basically hold your medication right there. It's ready for you to use. Just remove the cover for your mouthpiece. Take a deep breath, exhale out, and wrap your mouth around the port here, and go ahead and take a slow, deep breath. And if you can tilt your head up a little bit, it'll allow the medication to get to your lungs better, easier. If you do take a breath too quickly, there is a whistle right over here, and it'll basically tell you you're breathing in a little too quickly, and you're gonna want to slow down a little bit. Once you completely inhaled everything, go ahead and hold your breath for about 10 seconds, and then breathe out through your nose. And it helps, again, deposit the medication a little bit further down into your lungs where it needs to go. All right, and the medication is usually it's 2 puffs, so you're gonna want to do it, wait about a minute between puffs. And the medication usually lasts about 4 hours. So, but it's a rescue medication, so you're gonna be using this as needed. So when you're out in the job or exercising and you feel that tightness and that attack coming on, just have this with you. It's really important. Ideally both devices, and ready for you to use. So I'm gonna pull this apart, and if you can show me, just to make sure everything is understood, and in case I missed anything, you can tell me exactly what I told you.
Okay. So this is brand new. I would if this was brand new, I would get the drug and warm it up. And then this gets the albuterol ready.
Right.
And then I would put it back into the inhaler, and then I take off the cap.
Mm-hmm.
And if it hasn't been used, or if it's, like I said, brand new, I shake it.
Right.
Just to clear dust. And then check to see if it's ready. Then I spray away from me twice.
Perfect.
And then I don't put the cap back on, right? I
yeah,
do this. Right?
Yeah, exactly.
Okay.
Just go ahead and use the spacer.
Okay, so that means the drug's ready, and then I can go ahead and put the spacer on. And then I take off the mouthpiece.
Sure. And go ahead and actuate the device, so I have a
Okay.
dose there for you.
And then,
Mm-hmm.
so it has the drug ready.
Right.
And then what I want to do is I exhale first, and then I tilt my head back.
Mm-hmm.
I wrap my lips around the device,
And go ahead, take your
or
breath.
the
The
spacer,
Mhm.
and then I take my breath in.
Right.
I don't have to push it because it's already
It's
in
already
there, right?
in
Okay.
the spacer. Right.
And then hold my breath for 10 seconds,
Mm-hmm.
and then exhale to my nose.
Right.
Okay.
Exactly.
So
when you're
I'll just
ready,
do it.
yeah. All right, now we'll be doing this again. We'll just wait about a minute.
And then if I inhale too hard, it whistles.
It will whistle, so it'll tell you if you're breathing in too quickly.
Okay.
All right.
And
So
then I wait
About
30, like a minute.
about a minute
Okay.
between puffs.
And then I do it again.
Exactly. So you can go ahead and do it.
Exhale. Tilt my chin back. Okay. And then
So just pull that
then I can
away.
take this off,
Exactly.
and then put the cap back on.
Right. And put the mouthpiece back on to keep it clean
Yeah.
for storage.
Okay.
All right, good job. And you will be taking this home with you when you get discharged. We'll be holding on to the medication until then. For cleaning purposes, if you do need to clean it, you just use some tap water, no soap or anything like that. So just remove the canister, run in some water, and you're gonna air dry this. You can do the same thing with the spacer. Again, no drying with a towel, just some water, and again let it air dry. If ideally you can use, it would be a good idea to use a spacer, but if you don't have it, just have the device itself. You can wrap your lip around this again and exhale out completely. Give your tilt your head a little bit for better actions, and when you press down, go ahead and breathe along with it. It's better with the spacer to get more of the medication down to where it needs, but if you need to, you can do that, and it's a really good idea to have this with you. All right, do you have any questions? All right, great. So let's go ahead and take your vitals once again.
Okay.
Let's go ahead and start with the blood pressure. Oops, let's readjust that. Christian, do you mind holding on to this for me? Now, if the medication was a corticosteroid, like delivered through a DPI, I would have the patient rinse their mouth and spit and just prevent oral thrush from occurring. In this case, it's albuterol, so it's not really indicated for this. Thank you, Christian. Okay. Thank you, Christian. So I got a blood pressure of 115 over 75. So a little bit of improvement from before. That's good. So let's take your saturations here. So I'm putting your finger. All right, thank you, Christian. So you have a saturation of 98. That's good. Thank you. Take this from you. So I'm going to take your pulse again, okay? If you don't mind putting your hands across the chest right here, I appreciate it. It's a little easier. So I've got a pulse rate of 42 and 30 seconds. That's 84. That's pretty good. And also continuous respiration at 10 breaths per, for 30 seconds. Multiplied by 2, I got 20. So within normal range. So last thing, so we need to listen to your lungs once more.
Mhm.
We're gonna start from the back like before. So whenever you feel it, just go ahead and take a deep breath in for me, okay?
Mhm.
All right, thank you, Christian. Okay. So I'm gonna listen to the front once again, and with your permission, let me drop it down. I'll go from this side. So. Let me listen to your throat. All right. Thank you, Christian. Feeling okay? A little lightheaded? Anything?
A little bit, just from the breathing.
Okay. So let me know if you need to take a rest, okay? All right. So I'm gonna do this once more. So like before, we're going to blow out as hard as you can. Try to reach your goal right over here.
Mhm.
So we do this 3 times. So you go ahead and do this for me. Take a deep breath in and blow. Oh man, that's good. Okay. Second time. Again. Great job. All right, one last time here. Wow, great job. All right, thank you, Christian. Okay, Christian, before I leave, do you have any questions? Feeling okay? Yeah? All right. So,
I mean, I'm feeling good, yeah.
so if you do need to contact us, we do have, usually in these beds, there'll be call buttons on either side. Give us a call. Either nurse come in or they'll come fetch me. I'll be probably coming in to check on you again in about 4 hours, just to see how you're doing. And if we need to do this once more, we can do that at that point, okay? Right, so yeah, again, do you need anything, pillows, German TV, anything like that?
I'm gonna go see.
Okay, thank you, Christian. I appreciate it. So we'd dispose of the gloves and go ahead and sanitize the hands once again. And when we exit the room, so we go ahead and do our charting, take note of the patient's vitals pre and post, take note of how they look, cyanotic worker breathing, so the patient sounds okay. The breath sounds did have a little bit of crackle in the lower lobar area on the left. That's cleared up a little bit after the treatment. For the for this device, we go ahead and do the post minus pre divided by pre. We would be looking for 15% increase. improvement, make sure the treatment has actually been beneficial. And I believe that's it. Thank you for listening.